I think every individual will find their own place of comfort there. We know that some people, there was actually a very good study with young breast cancer survivors. And in the study, these young women generally just laid everything out on the table at that very first meeting. I had cancer, this is what I look like, this is what's going on, you know, chances are I'm not going to, because of my treatment, I'm not going to be able to get pregnant, etc., etc., etc. And then they watched for the response. And they didn't just listen to the words of the person, but they actually watched the body language of the person, and that was the litmus test to whether they would see that person again, whether they would get up at that point and say, hey, this is not going to work, you know, goodbye. So that's one way of dealing with that. Other young adults have told me that they generally don't tell on the first date or first meeting for coffee because it's too early. They don't know if they're interested, they don't know if the other person is interested. Some people feel that waiting for the third, fourth, or fifth date feels a little bit dishonest without disclosing. So for some people, around the second date is more comfortable. And I advise people to just say, I had cancer, and stop. As human beings, we're not comfortable with silence in conversations, right? So if you keep quiet, the other person is going to jump in to break the silence. So, you know, I had cancer. See what the response is. Oh yeah, I know all about it, blah, 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 blah. You know, I don't know what the person's response might be. If there's absolute shock and horror, that's telling you something as well. If the person says, oh, what kind of cancer did you have? That starts a conversation. The other thing that I think young people can do is actually get involved in a peer support group. And there are many different ones now online, and learn from your peers, because those are people who have walked the walk and talked the talk.